A 73-year-old woman is brought to the emergency department by her family. She complains of dizziness that started 2 hours ago. On examination, she is found to be bradycardic with a heart rate of 42 beats per minute. Which of the following is not an adverse feature that would indicate treatment with atropine and cardiac pacing? Options are A. Shock, B. Syncope, C. Heart failure, D. Myocardial ischemia, E. Palpitations. Pause the video for a moment and answer the question. Answer is E. Palpitations. The adverse features are shock, syncope, heart failure, myocardial ischemia. Extremes of heart rate. A 43-year-old woman presents to the emergency department with a history of central chest pain. After further history taking and examination, you make a diagnosis of unstable angina. Which of the following best describes unstable angina? Options are A. Pleuritic chest pain, normal ECG, negative troponin results. B. Pleuritic chest pain, normal ECG, positive troponin results. C. Pressure-like chest pain, ST segment depression, positive troponin results. D. Pressure-like chest pain, ST segment depression, negative troponin results. E. Pressure-like chest pain, normal ECG, positive troponin results. Pause the video for a moment and answer the question. Answer is D. Pressure-like chest pain, ST segment depression, negative troponin results. Unstable angina is not associated with positive troponin results. There may be ischemic ECG changes or the ECG may be normal, but the troponin is consistently negative. Pleuritic chest pain is not typically associated with acute coronary syndrome. Acute coronary syndrome, ACS, describes a group of clinical conditions, all of which usually present with chest pain or discomfort resulting from myocardial ischemia. ST segment elevation myocardial infarction, STEMI. Non-ST segment elevation myocardial infarction, STEMI. Other ECG changes, e.g. ST segment depression, T-wave inversion, or normal ECG, with troponin release present. Unstable angina, UA. Other ECG changes or normal ECG with troponin consistently negative. A 65-year-old woman presents to the emergency department following a fall at home. She has a past medical history of obesity and hypertension. On examination, you note she has a regular pulse and an ejection systolic murmur. She gets shortness of breath and complains of back pain when you lean her forward to palpate the apex beat. What is the most likely diagnosis? Options are A. Aortic stenosis, B. Aortic regurgitation, C. Infective endocarditis, D. Mitral regurgitation, E. Dilated cardiomyopathy. Pause the video for a moment and answer the question. Answer is aortic stenosis. Aortic stenosis can be a cause of shortness of breath and syncope due to reduced cardiac output. Post-fall back pain is very common and is simply due to trauma in this case. Ejection systolic murmurs are the classic sign of aortic stenosis, as blood is ejected through the narrowed valvular orifice under enough pressure to generate turbulent noise. The most common cause of aortic stenosis is age-related calcification. A 40-year-old personal trainer presents to the emergency department with a history of palpitations and lightheadedness. He tells you the symptoms have been at their worst in the last 12 hours, but he recalls similar episodes over the last 2 weeks. On examination, you note he is alert and comfortable at rest. Heart and chest auscultation is normal. His observations are recorded as heart rate 137 beats minute, blood pressure 128/65 mmHg, respiratory rate 20 breaths minute, oxygen saturations 97% on air, temperature 35.9 degrees Celsius. Pause. Options are A. 4-flecainide 50 mg. B. Synchronized electrical cardioversion. C. 4-sotalol 5 mg. D. 4-digoxin 500 micrograms. E. 4-metoprolol 5 mg. Pause the video and answer the questions. Answer is E. 4-metoprolol 5 mg. Offer rate control as the first-line strategy to people with atrial fibrillation, except in people whose atrial fibrillation has a reversible cause, who have heart failure thought to be primarily caused by atrial fibrillation, with new-onset atrial fibrillation, less than 48 hours of onset, for whom a rhythm control strategy would be more suitable based on clinical judgment. A standard beta blocker, that is, a beta blocker other than sotalol, e.g. metoprolol, or a rate-limiting calcium channel blocker, e.g. diltiazem, is recommended as first-line treatment for most people with AF. The choice of drug should be based on the person's symptoms, heart rate, comorbidities, and preferences. Digoxin is a possible alternative only in people with non-paroxysmal atrial fibrillation who are sedentary, do no or very little physical exercise,